Centuries ago, all prescriptions were written in Latin, but nowadays, only the direction for use has kept the trait. The prescription is written in English, but the directions for use are written in Latin. So I'm going to take you through some of the prescription abbreviations that are there so that you can just familiarize yourself with them. And this can help you learn how to read a prescription easily. First, we'll talk about when to take the drug. And when the prescription is written PM, it means evening. AM means morning. AC means before meals. And PC means after meals. HS means at bedtime. And PRN means when needed. This mainly applies to inhalers. And start means like you're supposed to be given one dose and you take it immediately. When it comes to how to take the drug, we have OD or QD, which basically means every day, once a day. And BD or BID means twice daily. TID or TDS means thrice daily. That's 3 times a day. After every 8 hours, you take the medication. And QID means 4 times a day. That's after every 6 hours, you get to take the drug. GAT, when a prescription is written GAT, it applies to drops, maybe eye drops or ear drops. And you might get something like GAT BD. This means a drop should be taken twice a day. When it comes to the route of administration, this is also included in the prescription. When it's ID, it's intradermal and should be given intradermally. IM means it should be given intramuscularly. ING just stands for injection, meaning it should be given as an injection. IV is intravenous. IT is intrathecal, which is an injection to the spinal cord. IP is intraperitoneal, which is injection into the abdominal cavity, and AC is subcutaneous. These are some of the routes that you can find in a prescription. When it comes to the period of drug use, this is what determines the number or the quantity of medication that can be given. This is usually calculated in terms of days, weeks, or months in a year. For example, let's say this, there are always 7 days in a week. So how it's written is that 1/7 in a prescription means 1 day. 2/7 means 2 days. I hope you understand that. There are also 52 weeks in a year. So when we say 1/52, it means that the medication should be given for 1 week. When we say 6/52, it means that the prescription should be given for 7 weeks. When it comes to months, we all know that a year has 12 months. So when a prescription is written 1/, it means that the prescription is a supply for 1 month. Another thing you need to note that is a prescription can be written in weeks, days, or months. Let's say you can say, 1/12 is equals to 30/7 is equals to 4/52. That is basically a drug supply for 1 month. I hope that is clear. So let's try an activity. You can write a prescription for a drug. Let's call the drug X to be given once daily for 8 weeks. You can write that down before I actually show you how it's done. Also try and interpret this prescription that I'm going to write down. Okay, this prescription means that drug X should be taken 3 times a day for 3 days, and this should be done after meals. The only way you can learn how to read and interpret a prescription is mainly through practice and familiarizing yourself with these abbreviations, since they are of Latin origin. And if you speak Latin, even better for you. You can go deep and try and understand the abbreviations themselves.